Good morning. Happy Wednesday. I hope you guys enjoyed Fat Tuesday. I don't know if you were off or not, but I was, and I enjoyed my day. So we're going to do some announcements for our 5-minute video today. The very first thing that I want to talk about is our medical terms. So today we are going to be doing the same list that you started on Monday, and today you're going to be doing the Learn feature. So get on, practice, do the Learn feature, and really get to know these medical terms. Remember, if you have trouble, that you can pull out your CPT and go to XX page, and you will see your medical terms there for a reference. So let me share my screen so we can get into our information for today. So again, today's Wednesday. We're on day 10 of 20. Remember, this is a 20-day module, and it ends on March the 8th. It's approaching fast. So I pulled the coding shot from your textbook, and I'm trying to see, I did not put the page number, but that's okay. Well, it's in your textbook. So this coding shot says the diagnosis codes Z23 report the need for a prophylactic or preventative vaccination or inoculation. These codes can be located in the index of the ICD-10-CM manual under the main term vaccination. Now, I want to make a point. I'm talking about your ICD-10 manual, which is your diagnosis manual, the big purple one, okay? So if you go all the way towards the back to the Z's and look at Z23, that's what we want to look at. We want to look at that diagnosis code. So if you go into your ICD-10 manual and you look at Z23, this is exactly what it looks like. Now let's take a close look at it. Z23 says encounter for immunization. So we're going to code first any routine childhood exam. And note, now procedure codes, that's what we get out of our CPT, right? CPT, current procedures, ICD-10, diagnoses. So procedure codes are required to identify the types of immunizations given. So Z23 is your diagnosis code for most immunizations because it's an accounter for the immunization. But your procedure code is going to say what immunization. So we're going to take a look at that. Okay, so let's see what page is on page 719. This is the very first page of your medicine section, and it's going to be your vaccines. So let's look at 90281, immune globulin, human for intramuscular use. 83, immune globulin for human or intravenous. Human for intravenous use. Now, I want you to understand that you have intramuscular, which is your IM, and your intravenous, which is IV. 90284, immune globulin, human for subcutaneous, which is your SC. I'm not sure if we've gone over that yet. I think I went over it at some point. I'm trying to think of which section, because you guys know I kind of get ahead of myself and work ahead. But IV stands for intravenous, IM stands for intramuscular, SC stands for subcutaneous. So why did I tell you all of that? Well, I told you all of that because when we were talking here, procedure codes are required to identify the types of immunization given. So this is going to be your type. Now there's several pages. I just took a picture of one page. Remember, we're kind of just dipping our toe in right now. I just kind of wanted to give you a frame of reference when you're looking at your CPT code and then how you're going to assign a diagnosis code for these vaccines. All right, so I put in a slide of pediatric vaccinations because when you start reading your scenarios, it gets a little confusing. So at two months old, they get their Dr. Hip. hepatitis, DTaP, RV, Hib, IPV, which is inactive polio vaccine, and their pneumococcal. So that's called the Dr. Hip 2, B Dr. Hip. Age 4 months old, they get their DTaP, their RV, which is the rotavirus, the Hib, IPV, and the PVC, or the PCV. PVC is a pipe, right? This is a PCV. 6 months, hepatitis B, DTaP, rotavirus, Hib, IPV, and the PCV. So you guys get the gist of it, that, you know, keep this handy. If you have a printer and you want to print it out, or just draw it yourself. So that way you can kind of keep in mind what vaccines are going to be given for what each age group. Sometimes when you have a scenario and it's giving you an age, this can be a great resource to see what they're actually talking about. Okay, so I'm going to get out of this and I'm going to show you something very exciting. So when you guys go to the doctor, look, let's say we're going to Happy Valley Medical Center Clinic. And, you know, we talked a whole lot about ICD-10 codes and CPT codes. And you're thinking, well, what does that mean when you go to the doctor's office? Well, have you guys ever seen a super bill? That's what this is. The doctor's marking on this as he's talking to you. They print this up. See, Jane Doe, time, date of birth, all of your information is here. The type of insurance. So whenever they pick up your chart, the doctor comes to the room. He's got this attached to it, and he's talking to you, and he's checking off these little boxes. For example, say that you're an established patient, and he spent 30 minutes with you. He's going to click off the 99212. So you're going to have a check mark right there. Then let's say that he's given you the Hib right here, 90648. He's going to check that off. So you're not actually having to go in and decide which CPT codes you're going to be using. Your super bill is going to be showing you this when you get on the job. Okay? Your super bill is going to show you what CPT codes. Now, if you're a coder, let me tell you what you're going to have to code. You see down here, he may put cough, COPD, whatever diagnosis is, and you're going to have to go find the diagnosis codes a lot of the time. Now, again, this is for an office visit. This is not for a hospital visit. So if you're coding and billing for a clinic, it's not nearly as difficult as if you're doing it for actual hospital. So I just wanted to give you a frame of reference of how all of this kind of comes together. So I wanted to show you a super bill that actually had the vaccines on it. I want you to take a good look at it. Take a good look at it. You may even want to look one up on the on the Googles, is what I'm going to say, on Google. Just Google super bill with vaccinations and print it up, and you'll have a cheat sheet for when you're actually doing your coding, because cheat sheets are wonderful when it comes to coding. So I was really excited about showing you a super bill to kind of make it come together for you, where these CPT codes are actually going to go, how they're actually going to be used by the doctor and the biller. And I feel like that this is going to be a light bulb moment for some of you to actually feel like, where do these things come from? Where are they going? How do we use them? This is how, on a super bill. I hope you've had a great day. I hope I didn't confuse you, and I hope you got as excited as I did to show you a super bill. Let me know if I can do anything for you. Remember, Zoom tomorrow at 2 o'clock. See you then.